My name is Dr. Jacob Basak, and I'm an assistant professor in the Department of Anesthesiology at the University of Colorado School of Medicine. I also subspecialize in critical care medicine, and am currently working in a lab that is trying to understand some of the mechanisms that are at play and dictate the cognitive changes that occur after an acute brain injury. Many of us have probably interacted with patients, possibly family members or friends, that have been afflicted with an acute ischemic stroke. And we know they go on to struggle with motor deficits, sensory perception difficulties, and also speech changes. However, one thing that is also not as readily apparent to the observer, but can be very frustrating for these individuals, is they can have cognitive changes after a stroke, including issues with thought processing and memory formation. Our lab is trying to understand the molecular pathways that may be targeted in stroke survivors to improve cognition. Specifically, in my project, I'm looking at how the pathophysiology of neurodegeneration may be playing a role potentially in post-stroke cognitive impairment. I've specifically found that the amyloid beta peptide, which is increased in the brains of Alzheimer's patients, is also upregulated in the brains of animals that survive an acute ischemic stroke. So the long-term goal of my project is to better understand the relevance of the amyloid beta peptide increases after a stroke, and potentially to see if we can repurpose some of the Alzheimer's disease therapeutics that have been developed targeting the amyloid beta peptide as a way of potentially treating post-stroke cognitive impairment in the survivors of a stroke.